Hey guys, I'm going to be reading from the Monroe Institute blog. Cancer patients using Hemi-Sync for relief. I may get tongue-tied, I may mispronounce words. That's okay. I don't work for the Monroe Institute. I'm not a medical doctor, I'm just reading a blog. Here we go. Our very own Brian Daly, MD, has worked with several oncology patients over the years. The following case studies are describing two such cases. According to the Mayo Clinic, alternative modalities like sound technology can help with common symptoms resulting from the diagnosis or disease such as anxiety, fatigue, nausea and vomiting, pain, difficulty sleeping, and stress. Case Study 1. Gretchen Grimm, who has given us permission to use her name, was a 21-year-old student at St. Bonaventure in 2007 when she developed Hodgkin's lymphoma. She started chemotherapy at world-renowned Roswell Park Cancer Center in Buffalo, New York. She was only able to complete 4 of the scheduled 12 treatments due to a profound nausea and vomiting, as well as complete hair loss. It took more than a year to regrow. Normally, hair should regrow within 2 to 3 months of stopping the chemotherapy. She had a holistic view of healing and opted to follow an organic diet for the next year. She had moved to Massachusetts and her symptoms worsened. Her doctor contacted Dr. Daly in Rochester, New York, and asked if Gretchen could fly down and be evaluated at Rochester General Hospital in Rochester, New York. Her chest CAT scans showed the tumor next to her heart had quadrupled in size with fluid around the heart and both lungs. She was unhappy with her oncologist at Rochester General. She was unhappy when her oncologist at Rochester General recommended the same chemotherapy again because it was the best treatment for her type of cancer. Fortunately, she trusted his judgment. He discussed her misgivings, including the nausea, vomiting, and hair loss she believed was sure to come, and her concerns about the chemotherapy being a poison not in keeping with her holistic beliefs. Dr. Daly suggested the use of guided imagery to think of chemotherapy as a love potion. She further suggested that she reframe how she viewed the chemotherapy drugs, and instead that she was getting a special formula chosen by an oncologist especially for her, mixed by an oncology pharmacist especially for her, and was created to make her well, not ill. Dr. Daly reminded her she was receiving an infusion of love, not a toxin. The energetic implications of chemotherapy were discussed. If she became ill, it meant the chemotherapy was working, looking for the positive. This inspired Dr. Daly to create a similar message and combine it with guided imagery and binaural beat frequencies to induce deep relaxation and healing. The resulting exercise became Chemotherapy Companion. The creation of the exercise was expedited, but did not make it in time for Gretchen's next chemotherapy treatment. Following the first treatment, she had been vomiting for 12 hours, the last 4 of which were spent kneeling in the bathroom in front of a toilet. Dr. Daly took the chemotherapy companion to Gretchen. When Dr. Daly saw her, she appeared drained and she was using her arms to support her head above the toilet. Dr. Daly reported he helped her into bed, slipped on the headphones, and started the exercise. When the exercise finished 40 minutes later, she took the headphones off and said, "That was awesome. I feel great." Then she got up and ate lunch. She never experienced nausea or vomiting for the remainder of her chemotherapy, which was terminated 4 weeks early due to her rapid response. She had no hair loss and looked resplendent in her gown at her friend's wedding as the maid of honor just 1 month later. Case Study 2. AF, whoever that may be, had a difficult time with nausea, vomiting, and diarrhea due to the effects of chemotherapy for colon cancer diagnosed a year earlier. It had recently spread to her liver, so doctors initiated a new chemotherapy regime, to which she again reacted even more violently. She immediately began vomiting during the first 90-minute infusion, The nurse caring for her said A, which was the name, experienced 3 explosive episodes of diarrhea that hit without warning. The person remained ill with nausea, vomiting, and diarrhea for 10 days, necessitating the cancellation of her second chemotherapy scheduled a week later. A family member contacted Dr. Daly asking for assistance at the oncology center for her second round of chemotherapy scheduled for 3 weeks after her first. The patient used the chemotherapy companion 15 minutes before her 90-minute infusion of chemotherapy started. When the exercise ended 45 minutes later, halfway through her infusion, she told the nurses she was hungry and ate a half of a bologna sandwich. When her infusion was completed, she left saying, "I feel better than when I came in." 2 ladies receiving the therapy on either side of her, who had been present 3 weeks earlier when she was so violently ill, asked, "What was that, and where can I get some? Or where can we get some?" Dr. Daly explained the process to both and gave each an exercise of their own before leaving. There are some other resources within this blog, and I'm going to put the URL to this blog in the show notes below.